Okay, so welcome to this presentation series designed to demystify diabetes and provide patients and caregiver with clear practical knowledge for better understanding and care. Today we'll tackle one of the most common and misleading question: is diabetes caused by eating too much sugar? So let's unpack the science behind this belief, separate fact from fear, and empower patient and caregiver with a real understanding. Now, many people ask whether eating too many sweets directly causes diabetes. The short answer is no, but it's more complex than that. Type 2 diabetes isn't always tied to obesity, and it's defined by persistent elevated blood sugar levels. For individuals who aren't overweight, indulging in sweets occasionally is unlikely to lead to prediabetes or type 2 diabetes. We should understand that there are two major types of diabetes: type 1 diabetes and type 2 diabetes. Type 1 diabetes is an autoimmune condition not caused by sugar or diet, where the body attacks its own insulin producing cells. Type 2 diabetes, on the other hand, developed from a mix of genetics, lifestyle, and metabolism. While natural sugars like those in fruits aren't the main issue, consuming too much added sugar from processed food and sweetened drinks can lead to weight gain, insulin resistance, and strain on the liver and pancreas over time. So, in other words, sugar by itself doesn't cause diabetes, but a diet high in added sugars, especially alongside inactivity, poor sleep, genetic risk can raise the likelihood of developing it. Now, glucose is the body's main fuel, absorbed from carbohydrates and used by organs like the brain and muscle. Insulin, made by the pancreatic beta cells, acts like a key, helping cells absorb glucose from the blood. After meals, insulin regulates rising glucose level in a feedback loop. In healthy individuals, blood glucose and insulin levels are well regulated, keeping blood sugar within a tight, stable range whether fasting or after meals. In type 1 diabetes, insulin isn't made. In type 2 diabetes, it made but doesn't work well. So consuming too much sugar and fat over time can disrupt body metabolism, leading to what is known as insulin resistance. When cells stop responding properly to the biological action of insulin, as blood sugar rises, the pancreas works harder and harder to produce more insulin, which eventually strain and may exhaust its insulin producing cell, raising the risk of type 2 diabetes. So the answer is no, diabetes isn't caused by eating sugar directly. But when excessive sugar intake is combined with inactivity, poor sleep, and genetic risk, it can tip the balance. It is the disruption of the glucose insulin loop that defines diabetes, not sugar alone. The glucose insulin loop normally keeps blood sugar stable, but excess sugar, especially with lifestyles such as overeating, poor sleep, inactivity, and genetic factors on your right side, can disrupt this balance, leading to breakdown seen in type 2 diabetes and may also worsen type 1 blood sugar level. Besides, high sugar intake can lead to weight gain and chronic inflammation, both of which impair insulin signaling. Sugar may play a role in increasing diabetes risk, but it's not the sole or direct cause. So, share this with someone who's still holding onto the myth. Next up, can you reverse diabetes? Hit subscribe and let's keep demystifying together.